Snoring Solutions, Exploring Causes, Impacts, and Remedies. Introduction. Snoring is a common condition that affects a significant portion of the adult population, leading to disrupted sleep for both the individual and their bed partner. Understanding the causes, health implications, and available remedies is essential for managing and mitigating this nocturnal nuisance. This article delves into the multifaceted aspects of snoring, including its prevalence, underlying causes, associated health risks, and various treatment options, with a particular focus on the emerging trend of mouth taping. Prevalence and causes of snoring. Snoring occurs when the flow of air through the mouth and nose is partially obstructed during sleep, causing the surrounding tissues to vibrate and produce sound. It is estimated that about 25% to 50% of adults snore regularly, American Medical Association. Several factors contribute to snoring. Gender. Men are more likely to snore or have sleep apnea than women. Mayo Clinic. Obesity or excess weight. Bulky throat tissue in the neck area can narrow the airway, causing or worsening snoring. Yale Medicine. Age. As people age, muscle tone in the throat decreases, increasing the likelihood of snoring. Yale Medicine. Anatomical factors. A long, soft palate, large tonsils, or a deviated nasal septum can narrow the airway and lead to snoring. Mayo Clinic +1, Yale Medicine +1. Alcohol consumption and sedatives. These substances relax the muscles of the throat, increasing the risk of snoring. Nasal congestion. Allergies, colds, or sinus infections can block nasal airways, prompting mouth breathing and snoring. Health implications of snoring. While occasional snoring may be harmless, habitual snoring can indicate underlying health issues and lead to significant complications. Obstructive sleep apnea, OSA. Snoring is a common symptom of OSA, a condition characterized by repeated interruptions in breathing during sleep. OSA is associated with increased risks of hypertension, heart disease, stroke, and diabetes. Daytime fatigue. Disrupted sleep due to snoring can result in excessive daytime sleepiness, affecting concentration and increasing the risk of accidents. Mental health issues. Chronic sleep disturbances are linked to mood disorders such as depression and anxiety. Strained relationships. Persistent snoring can cause sleep disruptions for bed partners, leading to tension and reduced quality of life. Traditional remedies and lifestyle modifications. Addressing snoring often involves a combination of lifestyle changes and medical interventions. Weight management. Losing excess weight can reduce fatty tissue in the throat, decreasing airway obstruction. Yale Medicine. Positional therapy. Sleeping on one side instead of the back can prevent the tongue and soft palate from collapsing to the back of the throat. Avoiding alcohol and sedatives. Refraining from these substances, especially before bedtime, can help maintain muscle tone in the throat. Treating nasal congestion. Using nasal decongestants or antihistamines can alleviate nasal blockages, promoting better airflow. Establishing regular sleep patterns. Maintaining a consistent sleep schedule can improve sleep quality and reduce snoring. Medical interventions. For individuals whose snoring persists despite lifestyle modifications, medical treatments may be necessary. Continuous positive airway pressure, CPAP. This device delivers a steady stream of air through a mask, keeping the airway open during sleep. It is particularly effective for treating OSA. Oral appliances. Dental devices designed to reposition the lower jaw and tongue can help keep the airway open. Surgical options. Procedures such as uvulopalato-pharyngoplasty, UPPP, radiofrequency tissue ablation, or nasal surgery can remove or shrink tissues contributing to airway obstruction. Mouth taping, an emerging and controversial trend. Mouth taping involves placing a strip of tape over the lips during sleep to encourage nasal breathing. Proponents claim it reduces snoring, prevents dry mouth, and improves sleep quality. However, the practice has garnered mixed reactions from medical professionals. Vogue.com, thesun.co.uk +1, nypost.com +1. Potential benefits. Reduction in snoring. Some studies suggest that mouth taping may decrease snoring in individuals with mild OSA by promoting nasal breathing. PMC, improved sleep quality. Anecdotal reports indicate better sleep experiences due to enhanced nasal breathing. Risks and considerations: breathing obstruction. For individuals with nasal congestion or structural nasal issues, mouth taping can impede airflow, leading to breathing difficulties. NIPOST.com, skin irritation. Applying tape to the sensitive skin around the mouth can cause irritation or allergic reactions. Lack of scientific evidence. Health experts caution that there is insufficient scientific research to support the widespread use of mouth taping, and it may pose risks, especially for those with undiagnosed sleep disorders. Cleveland Clinic. Expert recommendations: consult a healthcare provider. Before attempting mouth taping, individuals should seek advice from a medical professional to rule out underlying conditions such as OSA. Address nasal congestion. Ensuring clear nasal passages is crucial before considering mouth taping. Use caution with tape selection. If opting to try mouth taping, use hypoallergenic tape designed for medical use to minimize skin irritation. Conclusion: snoring is more than just a nighttime annoyance. It can signal deeper health challenges and significantly impact sleep quality, relationships, and overall well-being. While snoring is common, it should not be dismissed as inevitable or harmless. For many, it represents a modifiable issue with solutions ranging from simple lifestyle changes to medical interventions. Identifying contributing factors like nasal congestion, alcohol use, or excess weight is an important first step in any snoring management plan. One of the newer, more widely discussed trends in this space is mouth taping, a method meant to encourage nasal breathing and reduce open-mouth snoring. While anecdotal evidence suggests it may help some individuals, it should be approached with caution, especially in those with any form of nasal obstruction or suspected sleep apnea. Consulting with a qualified healthcare provider before trying mouth taping or any other sleep-related technique is essential. It's also important to remember that snoring affects not only the individual, but those they share a sleeping space with. Addressing snoring as a team, patiently and compassionately, can foster both improved sleep and healthier relationships. Sometimes the solution is as simple as sleeping in a slightly elevated position, and other times it may require professional evaluation with a sleep study or specialized device. Regardless of the cause, taking action to reduce snoring can lead to better sleep, improved cardiovascular and cognitive health, and enhanced quality of life. Whether through breathing techniques, addressing allergies, maintaining a healthy weight, or exploring treatment options like oral appliances or CPAP, the path to quieter, more restorative sleep is worth pursuing.